Welcome back to Coffee Talk with Mike and Janelle. It is episode 29, and as promised, we are back with you to talk about common side effects of the psychotropics that are typically prescribed to the population we serve. So I would like to focus on akathisia today. Mike, would you like to discuss a little bit about what this looks like?
Sure. So akathisia, common side effect, often missed or ignored, described as an agitation or a sense of restlessness. Individuals who can communicate will often say they feel like their skin's crawling from the inside. They have this constant need to get up, walk around, and pace.
So what medications typically cause this side effect?
So most commonly we think about it in terms of antipsychotics. Haldol, Prolixin, Risperdal, Abilify, others in that same class. Can also be caused by antidepressants, particularly the SSRIs, your Prozacs, your Zolofts, your Paxils. Calcium channel blockers, which are used for blood pressure, but also for other indications. And then meds that we give for dizziness or nausea can also cause akathisia.
Okay. And I understand there's risk and benefits with all of the medications that are prescribed
Absolutely.
to an individual. But if we're finding that this medication in particular is really effective in treating the target symptoms, what are we going to do and how are we going to treat this side effect?
Right. I mean, ideally, we would stop the medication or change the medication to something else or lower the medication. But sometimes that's simply not positive or possible. So when that's the case, what we will do is then add one of two different types of meds. One's in a class called beta blockers, classically used for blood pressure. Propranolol is the most common one that we use. The other class is in benzodiazepines, Valium, Klonopin, Ativan can be helpful. So if the person needs to remain on that medication, then we can add one or both of those to combat this side effect.
Got you. So folks, kind of discussed a little bit today about what meds can cause akathisia and what it looks like. So if you think you or a loved one may be suffering from akathisia, please reach out to your medical provider and inquire.
Absolutely.
All right. Till next time, folks.
APEC out.
APEC out.